There's a lot of crazy things in the news about GLP-1 medications. I'm going to give you my take as an obesity medicine physician who prescribes these all the time. Hi, I'm Dr. Meghan. I'm an obesity medicine physician and weight loss coach helping you cut through the pseudoscience and noise in weight care. My approach combines evidence-based medicine with real behavioral change. So you don't just take medications, you actually transform your health. So every day I see new patients and they have a lot of questions because there's a lot in the news, there's a lot on social media about GLP-1 medications, how they work, what they do, the side effects, and a lot of people are like, I am thinking about this, but I'm actually really scared. So today I'm going to give you my take on a couple of the big headliners. Number one, microdosing. So microdosing is when people take very, very, very low doses of a GLP-1 medication for a variety of reasons, but essentially it's the lowest dose or less than the lowest dose, and potentially no intention of going up to the highest dose of the medication, just taking a little tiny baby dose of the medication weekly or at regular intervals. I think it's a really interesting idea. And I've made lots of videos about microdosing in general, but I think the big question for me is if somebody is interested in microdosing, the real question is, okay, what is the goal? What is the goal you are trying to achieve by microdosing? So let's say I have a patient who comes in, their last doctor tried them on Zepbound 2.5, the lowest dose. They had a really hard time with it. And they want to get on the medication. They think it would really help them, but they just feel like their body still is having a hard time adjusting to the 2.5. And let's say for all intents and purposes that they could do an FDA approved, they could do, with the Zepbound vials, they could give themselves, half of that through the FDA approved Lilly Direct vials. So in this theoretical situation, they're able to dose a smaller dose through FDA-approved medication. Do I think that's a good idea? And for that situation, I think if it's logistically feasible, operationally you can do it, then it's something I would be open to trying because some people, and most people don't need this, but every once in a while somebody has a really hard time with that lowest dose. And if you can do it safely and effectively, doing an even lower dose just to give their body a little bit more time to adjust might be exactly what they need. And that's probably somebody who's going to need to go up slowly anyway, or may not even go above 2.5 milligrams or 5 milligrams of tirzepatide at all. So in that situation, I think, yeah, this actually could be helpful if you can do it safely and effectively. And of course, there are a lot of reasons why people would think about microdosing. And if this is something you've explored or you've tried or you're thinking about, type in the comment section below why you in particular are thinking about doing it. Because I think there's a wide variety of reasons. So I might make another video on this if people want to hear more about it. There's another set of people who, they're pretty happy with how things are with their weight, but they want to lose 5 to 10 pounds. And they think that microdosing is going to really help with that. And for those people, and I will just say right up front, there is nothing wrong with wanting to lose 5 or 10 pounds at all. There's nothing wrong with not wanting to lose 5 or 10 pounds. I think whenever people want to lose weight, my first question for them is, why is this a problem for you? You want to really like your reason why you are losing weight. If you want to lose 5 to 10 pounds because your partner thinks you should versus you want your clothes to fit better, there's a lot of reasons. I just want patients to like their reasons and feel really good about them, feel like this is really going to be healthy for them. Now, let's say I have a patient and they say, well, I really just want to lose 5 to 10 pounds. Can we think about microdosing? And the important thing to do is rule out all other causes of this additional weight. If it's a problem, I want to make sure there's no other medical issues. I want to make sure there's no medication interactions. I want to make sure nothing else is at play. But then usually for people who are in that, I want to lose 5 to 10 pounds, more or less, I also really want to make sure that they're really doing everything that they can in terms of lifestyle changes, because you're always going to feel better when you're exercising more regularly and you're eating more healthfully. But also, these medications do have side effects, and even the lowest doses can have side effects. And so I always feel like if you don't necessarily need these medications, it's always better to not be on them. Now, if I'm prescribing them for people, we really do feel like they need them, and it's a lifelong commitment. So I always want to be certain that we're on the same page when it comes to making that type of commitment. But I think if you don't need to make that commitment, it's great. And I have so many patients that we are able to get their weight down without medications. So some people need it, some people don't. It's not a value judgment. It's really what's going to be in the best interest of the patient. Also, I think something that, I've talked about a little, probably not a lot, but if somebody wants to lose a small amount of weight, but they're really just unhappy with one particular area, like maybe they are really unhappy with the subcutaneous fat around the middle, or they had 4 kids and they're really unhappy with their torso area, or their main concern is their arms, or if it's a very localized area. I will also, sometimes I think it's probably in the best interest of the patient to also think about plastic surgery for aesthetics if it's something that's really bothering them enough that they're thinking about making a lifelong commitment to a medication. This may be something where they could see a plastic surgeon, have some liposuction done, or have an abdominoplasty, whatever the procedure is. They may be better served seeing what their options are with regards to cosmetic surgery, if it's going to be, of course, safe, financially feasible, things like that. But then they don't have to be on a medication forever. So I think it's probably something that in the weight community, we don't talk about enough. Maybe, I don't know why, but if it's a very specific area, I always think, let's see what all your options are, and you may be much happier going that route versus medication. Next thing that's in the news all the time is this concern about muscle wasting. And I've made a whole video about this, and I will link it below. But the bottom line is it's really not something that I am seeing that's clinically significant. Now, maybe other obesity medicine physicians are, the ones I've talked to are not. I think it just gets blown way out of proportion. And of course, people are using these medications in somewhat less regulated circumstances. And I think that is also where a lot of these scary headlines come from, is people are not being monitored. So, and I'll get to that in a minute. But overall, I give this medication to people in their 20s if I think it's appropriate. I give this medication to people in their 70s if I think it's appropriate. But obviously, as a physician, I don't want my patients to have muscle wasting either. And what I have found is that if people are appropriately monitoring their, protein intake and their overall nutrition, and they are working out, these medications, because people are able to lose weight, I have found that not only are they not having muscle wasting, but they're able to be even more active, exercising more, strength training more, because they are just more comfortable. They're able to move around more. They're excited that they're losing weight. They're more motivated to go work out. So, of course, there's always going to be the rare circumstances where people have significant issues, but overall, as an obesity medicine physician, I would not be prescribing this if it was causing this sort of severe muscle atrophy, and it's just not in my clinical experience. Okay, and the last thing that people are always asking about is they're just really, really worried about terrible side effects. They hear about stomach paralysis. They hear about bowel obstruction. I think a lot of these scary case reports come from people who are not, they're not checking in with the doctor regularly. They're getting it from somewhere. It's kind of like a drive-through window that they're like, your insurance covered it, here you go. And they're texting on an app. They're not talking with an actual person. It's getting easier and easier to get these medications. they are prescription medications. You do need to be evaluated and you do need to be monitored as you go so that these things don't happen, because a lot of these things that you hear about are actually end stage complications of things that can be caught easily and quickly if somebody is monitored carefully. So for example, with things like bowel obstruction, that is often constipation that has just really, really progressed into the point where nothing is moving through the intestines anymore. And then it can become extremely dangerous. But in theory, this is something that can be detected before you get to that point. Now, of course, there's always going to be the rare person who has a very extreme early reaction to that. But usually you can prevent these things from happening if you are appropriately monitoring somebody. And then, of course, with things like stomach paralysis, part of how these medications work as a class is they do slow the movement of food through the stomach. Now, if somebody is having a lot of nausea and vomiting, ideally you're going to be able to catch that before and adjust the medication accordingly. Also, you are going to be able to see, is this an appropriate person? Maybe they have significant type 2 diabetes that already has set them up for stomach issues and stomach, motility issues. So overall, yes, every medication has side effects. Yes, there are always going to be the rare people who have a severe early reaction to the medication. And so somebody can look like a very appropriate candidate and then all of a sudden they have a very extreme reaction. That happens, but luckily it's very, very rare. And also, I always think it's important for people to consider there are side effects from not treating your medical issues as well. So if I have somebody sitting in front of me, they seem like a really good candidate for this medication. They haven't been able to make the lifestyle changes consistently that are going to get them to a healthier BMI. If I'm not treating them medically for that, that means in all likelihood that their BMI is going to stay high at an unhealthy level or get higher. And there are really significant complications that come with that. So as always, it's really a discussion between a patient and their physician, but I think these are also important perspectives to think about the risk of not treating, and also how important it is for someone to be monitored and to have a medical setup where you can reach out to your prescribing physician and you can chat with them about what's going on. If you have questions about any of this, leave this down below. If there's other headlines you want me to address, let me know. Also, if you're on a GLP-1 and you are struggling to get yourself to the gym, if you are really confused about what to eat, if you still have a very chaotic relationship with food, I will leave my info down below. I do work with people as a weight loss coach to help people around the world with all these issues and so many more. Thank you so much for watching, and please be well.